focused on Leptospira spp, the causative agent of leptospirosis, a zoonotic illness transmitted via animal urine-contaminated water, e.g. freshwater, floodwater, or recreational lakes. Each question has 5 answer choices and detailed explanations. Question 1. Clinical presentation diagnosis. A 35-year-old triathlete presents with fever, headache, muscle pain, and red eyes after competing in a mud race through rivers and swamps in Florida. He has conjunctival suffusion without purulent discharge. Labs show elevated creatinine, bilirubin, and mild transaminitis. Which of the following is the most likely diagnosis? A. Malaria, B. Hepatitis A, C. Leptospirosis, D. Typhoid fever. E. RMSF. Rocky Mount correct answer, C. Leptospirosis. Explanation. Leptospirosis is a waterborne zoonotic infection. Transmission: urine-contaminated water. Symptoms: fever, myalgias, especially calves, conjunctival suffusion, headache, may progress to wild disease, renal failure plus jaundice hemorrhage. Why not the other area? May cause fever and renal issues, but not conjunctival suffusion or recent exposure to mud rivers in U.S. B. Hepatitis A, typically from contaminated food, not water sports, doesn't present with conjunctival findings. D. Typhoid fever, presents with abdominal pain, rose spots, relative bradycardia, more common in developing countries. E. RMSF, tick-borne, usually presents with rash, wrist, ankles, not conjunctival suffusion or waterborne exposure. Question 2. Treatment. A 29-year-old man presents with high fever, vomiting, calf pain, and jaundice after swimming in a flood-contaminated lake in Puerto Rico. Labs show bilirubin, AST/ALT, creatinine, and mild thrombocytopenia. Blood cultures are pending. Which of the following is the best initial treatment? A. Azithromycin, B. Metronidazole, C. Ceftriaxone, D. Amoxicillin. Correct answer, C. Ceftriaxone. Explanation. For severe leptospirosis, well disease, the treatment of choice is IV ceftriaxone or IV penicillin G. For mild disease, oral doxycycline or amoxicillin is sufficient. Why not the others? A. Azithromycin, not standard for Leptospira. B. Metronidazole, used for anaerobes and protozoa, not spirochetes. D. Amoxicillin, can be used in mild cases, but not for severe presentations with organ dysfunction. E. Vancomycin, for gram-positive cocci, not effective against spirochetes like Leptospira. Let me know